Thank you everyone for being here on a timely basis. I'm Mark Adelman. I'm a pulmonary critical care attending at NYU, and I'm on APD in our fellowship program. And I'm really pleased to be here with my colleague Janae Heath from Penn, so that we can tell you guys a little bit about the ACGME Clinician Educator Milestones and how to use them for professional development. With that, I'll kick us off. Just initially, I have no disclosures. Janae, we're actually really fortunate, was a member of the ACGME working group that created these milestones. So I'm thrilled that she's able to participate in this and give us some insider insights into how they were developed. And I'll kick it off to her for now.
Hi, everybody. So, as Mark said, I'm really excited to be here. I am at the University of Pennsylvania, and I have really defined myself as a clinician educator from early on, but have been really lucky to be an APD for our internal medicine residency program, but also our pulmonary and critical care fellowship program. So, I was really lucky to be able to help think about generating this tool, and we are excited to share it with you. As we're going through, I think there's a couple questions that I really want everyone to just reflect on and think about. So just to get your brain flowing a little bit, I want you to reflect on, did you plan to become a clinician educator? If you go back to your personal statements written at every stage along the way, did this describe this pathway for you? And then in a really related question, I'll go back one more. When was the last time that you did a self-assessment of your educator skills? I think this is really in our mind the idea of where these came from to help educators develop skills and continue to grow. But think through the last time that you did that in a formal process. And then another thing to think about is, how much time have you spent learning or improving your clinician educator skills? So with those questions as a backdrop, we're going to transition and talk a little bit about the ACGME Clinician Educator Milestones. And I know I gave a few questions to reflect on as you guys were getting started and logging into this topic. But what I want you to think about is a few things. So how would you define a clinician educator? I think we have a small group of folks that have joined us, but if anyone's willing to share in the chat some words that come to mind, one or two words, that how would you define clinician educator? And I'll warn you that you might have many ways that you define it, but if anyone wants to share some things of how they define it.
Diane is off the hook because she has to go staff something in the ICU, according to the chat.
Mark, how would you define clinician educator?
So I mean, to me, I guess I've always thought of it as the faculty who are spending either the majority or all of their time as either probably an employee, or maybe sometimes with a more voluntary or private-based agreement with an academic medical center, but they're spending time working in the wards, ICUs, clinic, with the trainees, right? And I think that's the probably the big part for most of us, is that we either work directly with trainees or we work with other people that work with trainees in the academic setting. So there may be other formalized roles for people that have, research, whether it's into basic or clinical science, but the clinician educator to me has always been someone that works with trainees and to a varying degree often has the educator or the educator administrative type roles.
Yeah, I love that. And so I think Mark highlighted one really important thing, that in that little blurb that I put him on the spot for, he was able to identify so many different career pathways. And so as we're thinking about what it is to be a clinician educator, that's really important to recognize that there's not a one size fits all approach, and different skills that you're going to look to build as a clinician educator might be really different than your colleagues in your division who are also clinician educators. And it's just that thinking about the broad scope of what this career pathway means is amazing. There's a lot of great roles for clinician educators, but then we need a little bit of guidance of how to further build those skills. So next slide, Mark. So with that background, here's what we're going to cover today. So Mark and I were really excited to chat with you about what these ACGME clinician milestones are and kind of the background of where they were created, how they were developed. Mark is going to do an overview of some of the examples of the clinician educator milestones. And we're actually going to use like the second half of our webinar today to brainstorm and strategize with you to discuss how you can use these both within your own personal professional development, but also within your institution for faculty development, for fellow development. Next slide. So these came from the original idea of the ACGME clinician educator milestones was to recognize that skill development generally occurs on a developmental trajectory or framework. This is really akin to what you will see in the GME side of milestones that you might be familiar with. But the sense is that people start in various skills as novice and they progressively through time, experience, get higher levels of competence. So if you hit the next slide, Mark. And ultimately, the goal is to reach expert level. So for our residents and fellows in training, we expect them to reach a specific level of expertise by the time that they're finishing. But again, with time, practice, experience, you can imagine the same framework applied to people that are growing their professional development as an educator too, getting progressive levels of expertise in different domains. Next slide. And so the clinician educator milestones were developed probably because many people came forward and said, I don't know where to focus. Like I am desperate for faculty professional development, my educator skills, and I don't even know where to start. So this was the goal. This was intended and designed to be a tool for faculty development. I will say again and again that I think because the ACGME have milestones for graduate medical education, people often conflate those and think about using these for accreditation or other institutional purposes. This is really for self-assessment, for professional professional development in the educator realm. This is meant to cover across the continuum. So this is for educators that practice in the UME, GME, continuing professional development or CPD space, but it's also a tool that can be used for folks that are exploring career pathways as clinician educators. So our fellows in training, our residents in training that are looking at this career pathway, these outline a framework for that. And again, we really hope that they're going to be used and operationalized as a tool that you can use for self-assessment. Next slide. And then next slide as well. So the way the process of creating these is, started in 2020, and there's a collaboration between the ACGME, the ACCME, AAMC, and AACOM. And what it was faculty members, program directors, medical trainees, all weighing in and giving suggestions of kind of refining these and different core components they felt were really relevant to clinician educators. Next slide. This all started in the spring of 2020. So it was a lot of unexpected Zoom meetings around that time of the development because there were other important things happening in the world. But ultimately, after a lot of revisions and pilot testing, we were able to review these for prime time and actually put them out on the web in May of 2022. And our goal from May of 2022 to now has been to disseminate them and to promote them and just make sure people are aware of them. Next slide. So we started to have you think about how would you define a clinician educator, and just I put Mark on the spot to say how he would define it, but that's actually how we started when we were developing these, and we had a lot of discussion about all the different pathways and the different roles that people might define themselves as that are clinician educators. And the group that made this up was not just physicians, there was education PhDs that define themselves appropriately as clinician educators, and so I think had a broad representation that was able to help us really have full breadth of what the career path could be. And we landed on 3 big domains of career pathways. We see some folks that are educators, they're the bedside educators that really thrive on the individual trainee encounters that they're having to help people grow. We have folks that define themselves by their education scholarship and by medical education research. And then we have folks that really are integrated in the administrative side of things and they're education leaders. And we think about our program directors and our APDs throughout that lens. Next slide. And one final thing I'm going to highlight before I push it over to Mark to kind of go through what these ACGME clinician educator milestones are is if you take anything away today is that these are intended to be a tool for your professional development. And it's so different than how we use the ACGME milestones for GME, graduate medical education learners, which is really an accreditation requirement that we are kind of hitting a benchmark for our trainees to make sure they achieve certain competencies by the time they're ready to graduate. This is not that. This is really something to kind of give people a framework and an outline and a guidepost for how they can build skills and different areas that they can continue to grow in. So hopefully you guys will use it for those purposes. And we're excited to share it with you and talk with you about how you can use it in your own development. So I'm going to pass it over to Mark to take us through the next section.
Thank you, Janae. So I want to spend a little bit of time just kind of giving you guys an overview of what makes up the clinician educator milestones. I believe I first heard about them probably a couple of years ago. Maybe it was not long, maybe a year or so, probably after they would have been released, and it was at an APCC MPD meeting. But I think that they're still maybe not as widely known, or at least not in any real level of detail as maybe they could be or should be. And so hopefully you guys will appreciate learning a little bit more about how they're structured. So the competencies are first split into 5 broad domains. There's what's called the universal pillars for all clinician educators, where the goal is to demonstrate the commitment to lifelong learning and enhancing one's own behaviors as an educator. There's the educational theory and practice domain, meant to ensure the optimal development of competent learners through the application of the science of teaching and learning to practice. There's well-being, to apply principles of well-being to develop and model a learning environment that supports behaviors which promote personal and learner psychological, emotional, and physical health. There's diversity, equity, and inclusion in the learning environment, where the goal is to acknowledge and address the complex interpersonal, and systemic influences of diversity, power, privilege, and inequity in all settings so that educators and learners can thrive and succeed. And then there's my personal favorite, and everyone else's, I'm sure, administration. No, I'm kidding. But it's it's there, and it's an important one, of course, nonetheless, because demonstrating administrative skills relevant to our professional roles, program management, and the learning environment can help us lead to better outcomes with our learners and ideally with our patients. So there's a wide range of subcompetencies within each domain. The universal pillars, for example, have 4 subcompetencies. Educational theory and practice has the most, with 11 subcompetencies. And well-being and DEI are both domains as well as subcompetencies. They each have just 1 for each of those domains. Showing you a little more detail about the educational theory and practice domain. There are, as I mentioned, 11 subcompetencies. Each one of the subcompetencies has milestones from 1 to 5, similar to the way that the GME milestones are framed. And a little bit later, we're going to go into the supplemental guidebook that was created to go along with these milestones, so you can see how the domains, the subcompetencies, can be put into some actual useful practice, because the ACGME really did put a lot of work into the development of these, not just as sort of theoretical or framework type exercise, but really to try to make this as useful as possible, I think, in everyday practice for us as educators. I wanted to note specifically about the DEI competency and mention the what they describe as the overall intent, which is to acknowledge and address the numerous factors in diversity, equity, and inclusion that affect learners, the learning environment, and patient care. And I just want to single it out because I speak for myself today, and Janae is speaking for herself and not for the ACGME or our institutions, but I think it's important to make note of the DEI competency and domain, because as far as I know, the ACGME has not made any changes to the clinician educator milestones around this one specifically. That may be the case for some of the other GME related milestones or some other organizations, or of course reacting to what's going on with the current administration in Washington. But I'm proud to make the DEI work a component of what I do with our fellowship. And so I just wanted to make sure that we mention that today. Well-being is another example of something that's near and dear to my heart, and burnout prevention in particular is another domain and subcompetency unto itself. And just because there's one subcompetency doesn't mean it has any more or less importance than the one that has 11 subcompetencies. So moving on so that we can try to make this as interactive and as helpful for you guys as possible by maybe giving you some examples of how to use the supplemental guide, which I referred to just a moment ago. The supplemental guide is another document that's available on the ACGME's website that provides additional guidance and examples of how to use the clinician educator milestones. It clarifies a bit on the work group's intent or the rationale behind the creation of each milestone, some examples of how to use observation and assessment practices at each level, at each milestone level. It's even coded for UME, GME, and or CME relevant activities. And there are even suggested assessment models, tools, other references, and additional resources that the ACGME put together on a subcompetency base to make the process hopefully as low lift for us as busy clinician educators as possible, and that's something that I certainly appreciate. If you want to, if you have a chance and you want to click tap on the QR code, that'll give you an opportunity to open the link to the supplemental guide on the ACGME's website. When we go into the breakout group, I'll also have a screen share of it on my half, because what we're going to try to do with this is give you examples of how we could use this as a means of self-assessment or for peer assessment. Janae is going to tell you guys a little bit about kind of a peer-to-peer plan or developing a program on behalf of the division or department. And I will tell you how I would think about making a self-assessment plan for myself. I'm not sure how many people joined because I know people were kind of filtering in.
We probably should keep one room, Mark, but I
think
want
that's
to
fine.
and add one additional piece. So Mark outlined the many domains that the clinician educator milestones cover. That's a lot. And I will tell you that I think often when we're presenting this to people, people look at these and say, that is so much to accomplish. How can I do all these things? And that is not the intent. The intent is to identify your niche as a clinician educator and say, where does my career most line up? What are the skills that I want to focus on? So as I'm thinking about counseling people on how to use these, and we can talk about this too, it's kind of narrowing in the focus on what are the pieces that really ring true to you. So don't feel obligated to use all of those milestones, but pick and choose the ones that align with where your career is at. And you can do that under the guidance of a trusted colleague, a mentor, and things like that.
It will be very apparent I am narrowing things down as we talk about how I would work through the example of self-assessment. But you're absolutely right, Janae. I think that taken all together, it is a lot, but part of the point is that there are so many ways to define a clinician educator that they may not all be relevant or important or what we feel like we need to work on for ourselves. And the ACGME gives us the flexibility to work on a lot of different domains, and if we want to, ignore, the remainder of it, rather than feel sort of the cognitive overload of like, geez, there's a lot to do here. So I guess because we've got, a good number of people, but maybe not quite enough to really break into two distinct breakout groups, Janae and I will basically just discuss what we were going to go through in breakout groups and then have everybody swap to do, make sure everybody gets to see an example of each. We'll just go through it as one group. All right, so I want to thank everyone for participating as we kind of breezed through the supplemental guide and hopefully gave some useful real-world examples of how the guide can be applied for self and peer and even organizational purposes. Because I'm going to go back to just a few PowerPoint slides. And so if you guys just give me one sec, does that look all right?
Yep.
Oh, I didn't get to use my fun animation after all, but it's okay. Okay, so we'll pick up here. Thank you everyone for participating in the smaller group discussion and for turning your cameras on. We really do appreciate it. Just to recap, part of the goal here with the milestones and all of the work that ACGME has put into it is that self-assessment does not have to be onerous or time consuming. It doesn't have to be a chore. It, thanks to the work that they've put in, can be hopefully something that you find to be rewarding when a lot of the initial steps have been taken care of for us by the ACGME. Really, they did put a lot of the legwork in terms of organizing a framework, finding additional resources that you can then make use of for your program's needs. These were created by educators for educators. Hopefully we can't emphasize that too much. It's not for accreditation or regulatory actions or purposes, just like people may assume, or as the ACGME's other roles are. And why do I keep hammering on that? I think that's important for the ACGME to create or define itself as an organization that creates value for members and for programs, and not one that is, only serving a regulatory or accreditation type role. That's important anytime. It's particularly important maybe these days when there's been, explicit threats to accrediting organizations like ACGME or LCME. And so hopefully this is one way for ACGME to demonstrate its value to members and to society at large. So I want to thank everyone again for coming. If there's any questions, we're happy to spend a few minutes to take them. And if not, we'll say thanks and I'll send everyone on your way for the day.
Thanks for putting this together. Janae, obviously, thank you for helping create this document. I really loved how you are both reframed it today of like a tool for us, not necessarily this extra burden, and gave explicit instructions of like how you employ this, whether your institution, your peer direct observation, peer review, and then I honestly didn't know there was a Word document, nor would I have ever probably found it, nor decided that I should just delete chunks that didn't apply to me. That's genius. I love it. I'm really excited. So thank you.
Thanks, Rachel. Yeah, it seems like a dumb hack, but like it really does help me to focus on what I'm intending to, rather than just get lost in the weeds of the bigger version of it, which is important that it exists. But I guess I'm not the only one that thought about it that way, because that's why they created an editable version of it in the first place. So I love that and I appreciate that.
I think it's like exciting to talk about these and think about ways that people are using them. I think we all always learn so much from each other too. So if you have ideas of like ways that you're planning to use these, we would love to hear about it, because I think we're often trying to think about ways that we can do this better and help our educators really thrive. And I think actually that in institutions where they have a really robust framework for this, I think at OHSU, I think I heard they were doing a lot more with this. They've been looking at the professional development and professional identity of their clinician educators and found some nice correlates of just having a pathway that feels defined for folks. So I think this is a cool tool to use, and hopefully you all find it helpful. But really, like, I think we are best when we learn from each other and share with each other. So if you guys have ideas that you're going to implement, share it with us. We'd love to collaborate and think about it.
If there's any other questions, we're happy to take them. Don't have to cut things off. We have up to about 10 more minutes. There's an hour for this webinar. And if not, I just want to say thanks to the Clinician Educator Milestone Workgroup members at the ACGME, of course, including Janae, and for joining us today and for being a part of this webinar with me. I learned a lot while preparing for this and while working with her. And I want to say thank you to her and also to her other contributors who made previous versions of some of these slides, which I also was able to borrow from. So thank you for that. That includes Breach and Sean and Laura Edgar, who I'm sure a lot of people must know. I have been able to see Dr. Edgar present at again at the APC CMPD conference, and so that was great. Also just want to say thanks to the section on medical education for sponsoring the webinar, to Samantha Carpin for helping us to organize and arrange everything, and for Tara Walsh, who's here today. I guess there was some kind of scheduling snafu, and she wasn't able to join everyone on a group retreat that they're doing, and we're sorry for that for the conflict. But we so appreciate you being here and for helping us with the technical aspect of things today. And with that, we'll close and we'll say thank you, Janae. I don't know if you have anything else.
Thanks everyone for joining. Feel free to email us with questions or thoughts or ideas. We are available to help, so don't hesitate to reach out.
All right, thanks again, everyone.